What is it pouring on that? Wait, it's, holy cow! This is in a video game? We don't have anything in the emergency department that you can actually pour on to re-stick things back together. We have Dermabond, which is like a wound adhesive, but then to reattach a limb, you gotta reattach the blood vessels, you gotta reattach the nerves that they can find them, all the musculature, tendons, attachments. Nice. Oh! Oh! Of this laceration, you always worry about how deep it goes. Does it just go through the skin? Does it go through the subcutaneous fat? Then does it go into the muscle? We look to explore these things to see if we need to do multi-layer closures. You got to put the fascia back together. You got to put your muscles back together.
We can rebuild him. We have the technology.
Oh, right through the hand! Straight through the hand. You always worry about fractures. You have to worry about both sides sewing that up. You may not want to fully close it because you'll lock in any germs that are already there, even though you wash it out really well. Sometimes it needs to go to the operating room to get cleaned out, washed out, placed on antibiotics. Oh! What? Are you kidding me? A shovel to chop off the leg? Even when it's separated like that, you actually still believe you kind of have the leg there. It's called phantom limb syndrome. Oh, that's just messed up. What is that? Strong first aid medicine. If he's bleeding out, sometimes there's a medication that we use, TXA, the medicine that helps decrease bleeding. Oh my gosh, okay, perfect. We see the leg with a missing limb. This is an indication for a tourniquet. If you put the tourniquet on above the knee, you increase the risk of tissue breakdown and ischemia to anything distal. Distal meaning further down the road. If you do it just below, then you're just taking care of that section and stopping the bleeding. Oh, it's the magic medicine. I wonder how strong of a connection that binds to it. Somebody will ask, how long does it take for it to heal? You take the stitches out in, say, 7 to 10 days. But that thing is going to heal and form scar tissue over a long period of time, even up to 6 months, even to a year. What's she doing? Oh, screwdriver! When I said many times in the past, don't pull it out, in this situation, you have to. You can actually hold direct pressure if you're having a significant amount of bleeding. In this situation, pull it out and then use it against that individual zombie woman. There it is!
Now,
do it!
Let's see how you feel.
Go! Come on! Oh man, the twisting! Don't try to twist that. That's gonna hurt so bad. Yank it! Come on! You can actually even use your other hand together to pull it out and then pull it off because it's probably stuck in the wood or whatever it's attached to on that other end. Yes! He's getting it out! Yes! Oh, wow. Just destroying him. Blood smatter on the screen. It's never a good sign. Oh! Getting bit. Run away. Let's see what the hand looks like. Damn. They did a really good job of showing anatomy to make it look real. But in that situation, hold direct pressure, put a dressing around it, see if it stops. Some friends of mine who are in the military said they were even told just to throw dirt in there just to stop the wound. In this situation, oh, he's got an arrow through his thigh. Besides going through the soft tissue, did it go directly into the femur? And if that arrowhead's like stuck in the femur, it's gonna be really hard to pull out. Not so bad. If this happens to you walking down the street and you randomly get shot by an arrow, don't pull it out. You can snip it so it's not just this big thing just sticking out and get to the hospital. Nice. Nothing like a good staple gun. We use a staple gun all the time in the emergency department. It's actually quite useful in scalp lacerations, large lacerations anywhere in the body. It actually grabs the tissue and pulls it together. Oh, nice barbed wire. That's never good. Tetanus doesn't just form on rusty things, so to speak. We always worry about it when it's related to dirty wounds in general. When's the last time you got a tetanus shot? Was it within the last 5 to 10 years? If it's definitely greater than 10 years, we're gonna give you an updated TDAP is what we call it. Oh man, look at that. That is amazing. You can see the bone sticking out of the top. That needs to be rongered down or broken off and the tissue wrapped around it, and it's just gonna be a stump. It's wrapping it. Nice work. All right, that's pretty good. The way that it's wrapped is how we would do it. You typically probably wrap it a little bit further down the wrist if you had enough of the gauze or the Curlix, whatever type of material that you're using. Oh, man. Could you rip through it this direction? Yeah, you probably could if you had enough force and the object was sharp enough to go through there. But you really have to pull. Our tissue is very elastic, so it may not rip as easy as you'd want it to in this situation. Wow, he's being hung up. And yeah, perfect. You can see ripped right through it. You got the metacarpals here that turn into your phalanx of your fingers. Split right down the middle. Oh! Awesome! The anatomy looks pretty good. Major arteries run with major veins as well as the nerve. Not every single vessel in the body that way, but majority of them. Oh, it's so good. The blood splatter. I love it. It's like crazy. No, it would go. You're going to have arterial bleeding and venous bleeding. So your artery blood is going to be bright red because it's oxygenated blood. And the venous blood is going to be a little bit darker. Who the heck is that? That amount of force to break through flooring, even if it's really thin flooring, is a lot of force. If you fracture your sternum, fracture your first rib, or your scapula, that tells us there was so much force to the thoracic cavity that you have to really worry about internal organ injuries and damage. Run away! Run! Oh, he's just coming at her. Oh! We're in a flaming building. You have to worry about, one, decreased oxygen and smoke inhalation, and then it's producing all this smoke. A lot of times fires in industrial buildings, homes, they're burning other toxic chemicals. So you increase your risk of having, cyanide poisoning. Oh, right off the bat. Ouch. I don't know what type of yard tool that is. That's not your normal shovel. The likely laceration to the neck, hitting the carotid artery, hitting the jugular vein, and the potential bleeding out fast. It just depends on which vessel is actually hit. Oh, don't throw a grenade. Oh my gosh. Explosive injuries from a grenade. There's fragments that come off the grenade plus the compressive force. Things I think about when we see this is barotrauma. You pop your eardrums, you can collapse a lung pretty easily, and any hollow organs
I have hollow bones.
are at risk for type of ruptures as well. Oh, run, man, run. I mean, I feel like they stole that from Indiana Jones. Character gets crushed. Now, crushed with a big boulder, yes, that size will probably kill you. If not, it'll actually just crush your bones or the soft tissue. So we worry about rhabdomyolysis, muscle breakdown, high potassium actually. When the cells break, potassium gets released into the bloodstream. Too much potassium can actually lead into cardiac arrest. Wow. Think about being impaled with a pitchfork. Worry about right into the eye, into the brain, you're dead. There are incidences where people actually get impaled in their skull through their brain. Obviously not every single time. And if it's in a certain spot, they may not actually succumb to the injury. The world is coming at you. What? I've literally seen chainsaw injuries. They actually do a pretty good job of showing how the body's kind of reacting, moving, getting stuck because it's a chain. It's grabbing and ripping the tissue, and it's actually thick, right? It's not like a surgical blade. The injuries that I've seen are mostly just deep into the tissue. Sometimes you can see where they get to a bone. Most of the time it's extremities. How is that even in a game? I don't know what that is. Roman candle, dynamite, firework injuries happen, explosions happen. I've seen people's limbs get exploded off, hands, versus just simple lacerations. People hold it too long or knock over a fuse and everybody gets hit with them. The biggest things you worry about in these explosive injuries are the explosive tissues. Very much concerned about compartment syndrome, where there's so much swelling because of the explosion that's occurring. Oh! That's a massive bear trap. That was huge.
Huge.
And you think about getting collapsed with rusty metal. Obviously, the rust isn't the issue, but lots of bacteria and different pathogens can be on that. Besides just having laceration and trying to get out of this, you want to clean the wound out as best you can. Obviously, in a different situation, you'd want to come to the hospital and get evaluated and potentially get antibiotics. What is that?
There's always a bigger fish.
I mean, that is the biggest crocodile monster dinosaur I've ever seen. You get bit by one of those. Obviously, they have razor blade sharp teeth, just like a shark would. You have to worry about not just the pathogens that are in the mouth of the creature that bites you, but whatever's in the water due to open wounds. And then drowning incidents. How long could you hold your breath for underwater? Oh! Mauled by wolf, dog, or an infected, crazy zombie dog wolf.
Dog's a wolf.
We get animal bites come to the emergency department all the time. People are concerned about rabies. People are concerned about infection. We definitely treat with antibiotics for animal bites like this. We typically use a type of penicillin. It helps with the pathogens that are common. Here in the United States, rabies is extremely rare. If you do get bit, get to the hospital immediately, get evaluated. Oh, that's gotta be hot.
Feeling
Fire into the face. You're gonna get all your hairs singed on your eyebrows. You're gonna get your nose hair singed. The issue ends up being, are you inhaling this into your lungs, burning your lungs, and then closing your airway? What the hell? Yeah, just shake the guy off. That's what the game tells you to do. Come on.
Come on!
That looked painful as hell. Some crush injuries. Question ends up being you snap the pelvis and all the ribs around and can't breathe. You get pulmonary contusions. You snap a rib and you can actually puncture a hole in your lung with your own rib. Add insult to injury. And then you can bleed into that space as well with the blood that's coming from the lung and the rib itself. Oh, rope burn. Oh, that's how you actually lose a leg. What is he thinking?
What were they thinking?
You got to cut every one of those pieces versus just cut the one all the way on the end. That tight, you can snap a bone with that amount of pressure. You can dislocate the ankle or the joint that's down there. You can maybe dislocate the knee if it's pulling hard enough, if you have enough force going the other direction. Wow! Took an arrow right to the right side, right to the jugular. No, hit the lateral aspect of the neck. The jugular is underneath your sternocleidomastoid and some of your muscles here in the front. But actually could, if it was strong enough and enough force, penetrate maybe into the spinal cord itself. Oh! Somebody tell me what weapon that is with the ball and chain with the spikes on it. That's got a lot of weight behind it. You're going to cause fracture to the jaw. A lot of times when you have a jaw fracture, fractures on one side and the energy goes out the other. So you typically have two fractures to the jaw itself. People don't realize that actually most of the time an oral maxillofacial surgeon can actually fix these in the office. Typically it's just putting wires on the teeth to actually wire your jaw shut where it's a splint in itself. Oh! Whoa. If you strangulate somebody, how quickly do they die and how do they die? You can make somebody pass out pretty easily, but if you continue to hold it, are you decreasing blood flow to the brain? Are you causing swelling to the airway? These are other factors that you have to think about. Yo! I don't know if that was sliced in half or just electrocuted, but I was pretty sure, understanding the game and the movies, that those actually sliced people in half and was just like a super hot laser. Oh, that's Resident Evil all day right there.
All day!
Actually did a really good job. We got bit in the neck, still alive, bleeding out in the neck, appropriately grabbing the area, trying to put pressure on it. But it could be so much destruction that it's so hard to stop the bleeding on your own. And then you will quickly pass out if you decrease enough blood flow. And you might actually start stroking out because of hypoperfusion to the brain. What? That was freaking cool. A ton of puncture wounds to the body. Literally seen patients come in with multiple holes in them for multiple different reasons. It all depends on the areas that these are hitting and what it's puncturing. Major blood vessels, you're going to die quickly. Heart, you're going to die quickly. Any major chamber of the heart versus all just soft tissue. anything in the mouth bleeds a ton. If somebody's tongue is cut off and it's bleeding everywhere, you need a specialist like an oral maxillofacial surgeon or a plastic surgeon to be able to help. If your tooth comes up balls out, you bleed a ton. You have your major blood vessels running next to your neck here, but on the inside of your mouth, it can actually get lacerated. It's behind your tonsils. Super dangerous if something gets punctured back there, so it can bleed a ton as well. Oh! Holy cow, the amount of strength it would take to not only impale, but then to rip a body in half is beyond what I can comprehend for a human being. Usually it's a mechanical issue or gravity issue. They get ripped in half because of a car accident, but not from necromorphs that are just ripping you apart. Holy cow. Like, run. So I know in the first game, to kill the necromorph, you got to chop off like the limbs. So I'm assuming that's similar in this game, but with cooler weapons because they're bigger, so you got to use, bigger weapons.
You're gonna need a bigger boat.
It's really cool. The suit that they're wearing, the light is basically on the vertebrae in the back. Not sure if it's connected to it or not, but it just looks pretty impressive. Getting shot up in the legs. Literally, we see people come to the emergency department where they have lacerations or crush injuries to their legs. The biggest thing that we worry about is the blood vessels. If they're bleeding, that's your first thing to try to fix. Sometimes if it's uncontrolled bleeding in the pre-hospital setting, somebody will actually put on a tourniquet. Oh no, the eyeball. I remember seeing the eyeball scene in the first one. What? This is actually correct. There's a specific type of lid retractor for your eyelids to keep them open. It's really hard to keep your eye from moving. A lot of times when somebody's having eye surgery, you'll have an anxiolytic like Ativan or Xanax or Valium to basically calm you down and try not to move the eye. Oh! Come on! Come on! So you have the bone on the backside of the eye itself. That's where your blood vessels and your muscles and your optic nerve, everything kind of rolls through in that area. It is darker blood, which is most likely venous blood. So we look at our arms and we see like the blue veins, right? It's not blue. The darker blood is more deoxygenated blood. Oh, sick! What? Whoa, we got like a spear gun.
Where's my spear gun?
Going up through the left upper shoulder area, through the chest. If you hit the shoulder, there's bone, right? If you hit the left upper chest, you worry about the lung, and you actually worry about major blood vessels coming off of your aorta, so your subclavian artery right underneath your rib here. Sometimes we'll actually go into those for a central line. So you're at risk of puncturing a major artery right there. Oh! What are these things? Those are nasty. Got shot in the neck just above the manubrium, basically where your clavicles are. You're worried about trachea, esophagus. You're worried about major blood vessels. You're worried about the spine straight through the back. If you just sever the spine through one shot like that, there's no connection from the brain down to the body. Use some space weapon that just took off the head. Really hard to do. The neck is very vulnerable because of all the major structures that are there, but also it gives us the advantage of being able to rotate and move around easily. Surgery.
I'll cut you out of there. Is that a tissue laser? A plasma cutter?
Surgical tissue incision in progress. So plasma cutter. I don't have these in the emergency department. We just use scissors and knives. Sometimes we have cauterization, but only in sophisticated operating rooms do they have really cool high-tech stuff that I'm not privy to at the moment. Oh, there's the necromorph. Turn the lasers on the necromorph. Oh man, I don't think he's alive anymore.
He's dead, Jim.
Multiple puncture wounds to the lungs, the heart, maybe the abdomen. You're not gonna die right away unless you bleed out or the heart's just totally trashed. If you rupture through one of the ventricles, you can bleed out pretty fast. But if there is a hole, then you actually potentially fix it. Grab a staple gun, staple it shut, or grab big suture material and just sew that bad boy shut as fast as you can. Wait, what is this? We got, looks like an ice pick with maybe an eyeball on the end of it. Looks weird. What? Taking an ice pick or whatever it is, screwdriver to the side of the head. The bone is probably a couple millimeters thick there, maybe a little bit more. You got the soft tissue, so could that actually happen? Yes, if you have enough force, and there was a lot of force with that. Straight into the brain there. You're worried about your temporal lobe as well as your parietal lobes, which is different parts of the brain. Uh-oh. Oh, flying through space and just smack into something. What we do for a living as emergency medicine doctors and trauma docs is bad car accidents where people literally hit a solid object. You can have something as simple as just muscle strains versus decapitations or crush injuries. The lacerations that we see, the tissue just pops open and explodes due to the pressure. If you're just out there and you're exposed to the environment of space, you have all these things you need to worry about and can mess with your breathing, your lungs, bad things happen, and it's not sustainable with life. Whoa, 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 whoa. That is the fastest evolution I've seen of a necromorph. Puncture wound straight through the forehead, right into the frontal cortex, and now we have maybe implanted some infection or genetic mutation. Do we have a pathogen that works that fast? Not crazy that fast. It needs to get past our defense systems first, our natural immune system. Hours versus like the split seconds. Cool.
Awesome! Cool!
All the muscles of the neck. So the outer layer just under your skin is called your platysmus, but then underneath that you have your scalenes, you have your sternocleidomastoid, you have a lot of different structures just hanging right there anteriorly. Obviously you have different muscles on the back side of your neck, but really cool. Oh, we got a syringe filled with something. It looks white. A white liquid that we typically use in the emergency department ends up being propofol. Propofol is something that we use for sedation. That is one long needle. The only time I ever use needles that long is for a central line, which is a big major IV in one of your major blood vessels, or like a spinal needle. Those things can be really long too, but they're typically pretty skinny. Oh, wow, that even just hurts my eye. That is straight into the brain. Can you actually survive that? Yeah, maybe. I've seen people and I've seen images of nails to the head where it hit specific area and didn't hit any major structures. Same thing here. You're gonna lose your eye. Is it sustainable with life? Maybe, but then whatever's injected in is now in your brain. Oh! Wow. Impaled into the thorax in the back. Into the lungs, you're gonna have a hemopneumothorax. Basically, you're gonna bleed into the outer aspects of your lung. Air is gonna get on the outside, so everything's gonna start collapsing down. If it's high enough, you potentially can get some major blood vessels, breaking bones, pain, all this stuff. And somehow I see the right arm just disappears. If the person only has that injury and your arm comes off here, definitely want a tourniquet above. At this point, the limb is probably trashed in the sense of it's so ripped apart that it's really hard to reattach those major pieces. It's just gone. Gone! Oh, whoa, wow. I gotta unpack this. Does our blood pour out like that? Typically not. It's gonna flow out at a steady state. If you have an arterial, it's gonna pump out. The necromorph is jacked, by the way. You can see all the muscles, triceps, the shoulders, the deltoids. Oh my gosh. Obviously this is a dead character, but it raises a question of, could you actually live without your skull on your head? Typically not. You don't see anybody walking around without the top of their skull. Now, sometimes people are actually born without a covering of their brain, and that's not compatible with life. And people typically do not survive that. Some people do get pieces of their skull removed due to traumas and injuries and then have tissue over top of it, covering it. And yes, they can survive with that. And you just have to be really careful to that soft part of the brain. You cannot live without your brain covered. Amazing. Holy cow. People always ask, hey, can you live if your body got cut in half? Unlikely in this situation. You're just gonna bleed out and die. Your aorta is cut, your inferior vena cava is cut, and you're just gonna bleed out. So then could you actually stop the bleeding and survive if everything else was intact above? Probably for a short period of time, but then your collecting system and your renal system is now shot. Your ability to clean up the waste products and get them out of your body is now non-existent. Careful. Oh! Burn injury, horrible. We characterize burns as 1st degree, 2nd degree, 3rd degree, and the unspoken 4th degree. If you have a deep 2nd or 3rd degree burn, you need to have a skin graft done. You can use an autograft where you actually use your own tissue. And then the other way is actually to use fish skin that they actually generate in a lab, which is very interesting. Wow. Just going for the jugular. We always talk about how the neck is such a vulnerable place.
Look at that neck!
Here we have the sternocleidomastoid that comes down. You have your scalene muscles and your platysmus that covers over top of it. Underneath that, you have your jugular vein, which sits on top of your carotid artery. Typically, the arteries are a little bit deeper than the veins. That's why vampires, necromorphs, everybody's going for the neck because it's a vulnerable area. Oh. So cool, look at that. The spine that it's all integrated in, very cool.
Very cool stuff.
Good job of the graphic designers of this game. Oh, whoa, the transformation was so fast, holy cow. You see the spikes coming out of the spine in the back? Literally, it just looks like an overgrown spinous process. The vertebrae that we have in our back, it has those spikes. You can feel them, each one on your back. And these are just like sticking out further. It's actually attachment points for a lot of muscles and different movements of our back. Oh! Puncture wound to the face down. The question ends up being, does it get into your airway and cause an issue to where it kills you that way? Or does it spike all the way down into the thoracic cavity, injuring the major blood vessels of the heart? Like, why is it actually killing you? Oh, what? Holy cow. When somebody has big major puncture wounds or lacerations to the neck, most of the time, these need to go directly to the operating room because it needs to be explored to see which structures are injured to repair, obviously, the major blood vessels first. But you're also looking at all the nerves that are coming down. Ooh, electrocution. We see a lot of people who come to the emergency department with electrical injuries. Typically, it's construction sites or people building homes. It's messing with your nerves. It's burning your muscles, burning your tissue. The breakdown of that can cause kidney failure to where you can't excrete anything out. You could have blood in your potential urine. The other components is it can cause cardiac arrhythmias and cardiac death. Oh, and you just got demolished. The amount of blood that just like pulled out of that body. We have only a finite amount of blood in our body. Maybe 10 to 11, 12 pints of blood. Not all like distributed, say, in one area of the body. So it doesn't fly out like super fast. If you lose 40 to 50% of your blood volume, it's not compatible with life at all. You're gonna die. Oh! What is this? It's so gross.
That's gross.
It almost looks like the string of an intestine without any mesentery attached to it, because intestines are depicted as being just these strings of tubing, but they're all connected. We're connected. Obviously, it's causing strangulation, compression to their major blood vessels. They're not getting blood flow to the brain, which is going to cause somebody to pass out, which then causes more pressure on your airway. And as you pass out, you're going to lose muscle tone in your neck, which then you're going to be able to cinch even tighter to cut off airway. Oh my gosh. So if you're hit the inferior vena cava, which is the major blood vessel of the lower extremities going back up to the heart, that could be hit and pull out blood, versus your abdominal aorta, which is the major blood vessel going down, supplying all your blood. If that gets lacerated or injured, people succumb pretty fast. We see people all the time who come to the emergency department pedestrian walking and slammed by a car. We run that as a major trauma because cars are going 20, 30 miles an hour. They're going to cause a lot of damage to a human body. You get the injuries from being thrown, just the blunt force of landing. You can see ruptured organs, skull fractures, intracranial bleeding, a lot of things going on. Oh! We see crush injuries a lot, and you don't just worry about the injury itself. You always worry about potassium. You worry about cells bursting open, and the potassium is actually stored in the cells. And when you release too much potassium into the blood, you can go into cardiac arrest. We'll give insulin to help shift it back into the cells. We'll also give sodium bicarb. We'll also give calcium gluconate or calcium chloride to help stabilize the muscle tissues. Okay, here we go. Whoa, 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 whoa. Impaled into the chest, possibly. So if you get impaled into the chest, there's a potential of a pneumothorax, hemothorax, blood or air surrounding around the lung. And then if that fills up too much or too much air pressures into the chest, it'll collapse basically and then push too much pressure on the heart itself and not allow it to fill up. And then it doesn't allow you to get blood back, which then you can't perfuse your tissues and then you'll potentially die if it's not fixed. It definitely looks like a rolling pin, so it's not a sharp object. So it would take a lot of force to be able to actually impale somebody with that because it's a blunt end, really hard to get into the tissue, to puncture the tissue, and then cause more damage. Oh! We see people who come to the emergency department all the time with mechanical falls. People fall down. People will literally fall from a standing position down to the ground and complain that they might have fractured their tailbone, which we call a coccyx bone. They can have a hip fracture. The question ends up being, did you have the hip fracture that caused you to fall, or did you fall and then get a hip fracture? The left arm just totally gets torqued the wrong direction. We see people who get dislocations of the elbow or just spiral fractures of the humerus itself. A lot of times a proximal humerus fracture or one that's at the shoulder itself actually heals well on its own. But if it's a mid-shaft, we definitely want to fix that. And we always worry about messing with the major blood vessels. You have your brachial artery that comes down here. Whoa, 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 whoa. We have a cervical fracture causing a major injury not compatible with life. It disrupts the information coming from your brain down to your body in your brainstem, which is basically your autonomic nervous system, where it's just telling your heart to beat and giving you your respiratory drive, those sorts of things. Oh! Impaled object that was sharp directly to the side of the skull. Basically on that side, you're going through your temporal lobe, possibly through your parietal lobe, and just depending if you're right brain dominant versus left brain dominant. And if there's enough bleeding, you're not going to be able to, survive this injury. What's happening? I just saw a head explode. Please, somebody tell me in the comments why that happened. Was it being strangled or was there some other energy at play there? I don't know. Typically, the head is not just filled with a big ball of blood. The major blood vessels, your arteries of your neck and the veins of your neck, yes, they have a lot of blood there, but they typically don't explode. Obviously, if the head's gone, the body is going to collapse to the ground. Not like, say, a chicken with its head cut off where it's still running around. We don't have that continued function going on. You will see in certain circumstances after somebody does die, you might have some basic muscle contractions. Those are lower motor neurons, muscle fibers back to the spine and back versus anything going up to the brain. Holy cow. I am assuming that these characters have a ton of strength given the fact that they are robotic. The guy goes flying across the room. That obviously is not going to necessarily kill you unless you hit your head, have intracranial bleeding, skull fracture, cervical fracture, or you have enough blunt trauma to your chest that actually causes your heart to get stunned where it actually goes into cardiac arrhythmia. Head just placed right into a fan. We do see people who get injured by not fan blades, but a blade of a remote control airplane. I've seen really bad lacerations from that high speed blade that's spinning. But if you're getting it to your face and say this is a metal blade, it's just gonna rip apart all the tissue that's on your face. Oh! Hook right into the hand. We do see people who get impaled, injuries to the hand itself. You can basically break the bones of the hand, or you can miss them and actually go in between them. And then you also worry about all the blood vessels that are running next to the bones, as well as all the muscles, very integral muscles of our hands. That's why we can move them in so many different directions. Just sitting at my desk doing some work. Oh my gosh. I've never seen a guitar used in such a fashion. It looked like it hit right in the heart from the anterior aspect. If you have enough force, like that thing is coming out like a rocket, yes, that potentially can rip right through you. If I threw it, yeah, no, that's not going to impale anybody. What? You can push enough pressure that you can actually rupture somebody's eye and enucleate it.
Nuclear.
Basically have all that liquid come out of the eye. The major blood vessels around that area are more in the posterior aspect of it, not really much in the front. You'll have some bleeding, but not that much. Obviously, your eyelids are going to potentially close, or it's going to be empty socket. Could you actually crush somebody's skull? Pretty hard to do unless there's a defect already, but even then, really hard to crush a skull. You'd have to be in a heavy-duty commercial machinery or flip it upside down.
Upside down.
And you fall on top of your head from a very high fall. These types of animatronic characters, they have immense amount of strength. Nuts. So you're taking that hook again right up almost at the base of the neck above the clavicle. So you actually have your subclavian vein and the accompanying artery going right with it underneath the clavicle. Gets choked out, it looks like. Sometimes if you take a lot of trauma directly to the neck itself, you can actually cause spasming of your vocal cords, which will actually feel like you're choking and you can't breathe. Oh, there you go. Fight back. Oh, and a broken arm. Fracture your arm, fracture of your humerus or the radius and the ulnar. Horrible, painful. Basically, it's going to swell up a lot because there's a lot of blood vessels in that area. We see people come in with a upper extremity fracture, say of your humerus, and there's just pools of blood. There's not much to do. Really hard to actually splint this upper part of the arm. Obviously, you'll follow up with an orthopedic surgeon, and then they may or may not have you go to surgery, or they'll put a full cast on your arm all the way up into your armpit. Oh my gosh, that looks like a heart. The blood vessels coming off look appropriate for a heart. It almost reminds me of Indiana Jones and the Temple of Doom, where they take out the heart too. Probably all one color. Sometimes there's fat deposits around the heart itself and maybe a sac around it, and it would be quite bloody. Somebody who's getting shocked like that, that is probably more of an AC current type of electricity. Typically, if it's DC versus AC, so alternating current versus direct current. A direct current, if there's a lot of energy, you actually get one shot and explode because it's like boom. Versus AC, it actually sticks to you basically and causes flexor contractions. Oh gosh. Putting your head inside somebody else's mouth is probably not the best idea. Dental injuries, bite wounds, something that I do see in the emergency department. We see people come in with human bites, so somebody else biting you. Sometimes it breaks the skin. You worry about the different bacteria that can actually get embedded in. With puncture wounds, you worry about the bacteria getting seeded down. So if you actually suture it closed, you're actually sewing in the bacteria. No! Oh! No! What is going on?
What is happening?
Crush injury to the face. Crush injuries that we end up seeing are typically due to falls, bats, or hammers, or crowbars. And then obviously car accidents are a big one. A lot of times those will end up at a trauma center. Oh my gosh. Okay, so electrocutions, they do occur commonly. The energies and the electricities are usually low. It can cause muscle contraction. If you're having full body, high energy injuries, then it can cause cardiovascular events. It can cause asystole, where your heart just stops. You're always worried about the burning of the nerves, burning of the tissue. If there's too much tissue damage, what ends up happening is the breakdown of those cells. The byproducts of it end up going through your kidneys to be filtered out, and actually can cause kidney failure. What is this hook as a hand and impale somebody in the head with it? It is probably not super sharp, but it's pointy enough that it can cause a penetrating trauma through the skull. Now it's hitting on the left side. If it doesn't go all the way through, you always worry about an epidural hematoma caused by an injury to the middle meningeal artery. Then you can also hit that parietal part of your brain, which ends up being a lot of important structures where motor function is, where sensory is. Basically choking this individual. It's cutting off airway as well as potentially decreasing blood flow in and out of the head.
Blood just drained from his face.
You can crush somebody's windpipe, trachea, and cause inflammation to where you can't get any air through the area. You can compress it down, which is difficult to do. And then the other component is the major blood vessels that are running along each side of your neck. crush injuries by other people's hands. Obviously, it's not likely. Could it potentially happen? Obviously, there's always exceptions to the rule, but you wouldn't necessarily find yourself in a common situation where that would occur. Whoa. Facial traumas, facial injuries, they do bleed a lot. The face is so vascular, which in itself is actually a benefit, because if there's any potential of wounds, the likelihood of them getting infected is pretty darn low, and they heal really well. Same with the tissue of the face, that heals really well because of so much blood supply to that area. Oh my gosh. And then obviously, if there is a lot of bleeding, we need to clean it up as much as possible, find where the bleeder is coming from, and try to get it to stop. First, always try to use compression, so push pressure on the area, hold it now for a little while, see if it actually self-heals, and if it doesn't, then we actually have different types of suturing techniques. This gurgling noise that we all believe to be basically somebody's neck is cut. We typically don't hear that very often in the emergency department. It's not super common to have somebody's neck lacerated and coming to the emergency department. But typically, if that is the case, you want to secure airway first. So if the airway is cut all the way through,
Slit his throat from ear to ear.
you have the opportunity to either put a tube near where the cut is or through the cut if the trachea is accessible. Oh, that's a lot of sharp teeth in there, okay? All I can see is like puncture wounds, injuries. It almost is similar to like somebody getting bit by a shark, because there's multiple layers of teeth there. A ripping, brutal type injury where it's not a smooth cut. So the tissue is very hard to put back together. A lot of times when somebody has really rough edged wounds, we actually have to cut some of the tissue away to be able to make smoother edges so we can actually bring the tissue together. Otherwise, it won't heal right. Is a trick.
That's bait.
What are we doing here? Oh, come on. I saw that coming a mile away. Facial traumas by potentially a bite. So you could actually have a lot of bleeding again. It's just like a superficial flesh wound.
Just a flesh wound.
You won't necessarily bleed out unless there's a neck injury. You do have some major blood vessels of the face that are basically branches off of the external carotid arteries. One goes deep inside and the other one goes superficial. Oh my gosh. Oh. Come on. Come on! Single knife wound injuries. We do see a lot of them depending on where somebody is injured. Depends on how we approach it. So if it's into the chest cavity, always worry about bleeding on top of a punctured lung or any major structures underneath that. Versus arms or legs, and you just worry typically about any major blood vessel, and then it's mostly a superficial wound. Anything into the abdomen itself, you worry about organ punctures. So a lot of times you'll get a CT scan and then possibly just go to the OR immediately, especially if it is very deep. And then obviously within the thoracic cavity, you also have your heart. The big thing is if the heart is punctured, you will potentially die quickly. Oh. Oh, blunt head trauma. Solid object to the skull itself. Your bone is the thickest in the front, but it also have sinuses here, so you can actually have a fracture of part of the sinus because it's basically a pocket of air, so there's a bone on either side. If there's a fracture all the way through, especially in the sinuses, you always worry about potentially a cribriform plate injury, which basically connects the brain to the face itself and the nose, so there's always an increased risk of infection there. If it's not a massively displaced skull fracture, most of the time they'll heal on their own, but you definitely need close observation. Oh, so he goes inside the suit. Okay. Oh! The spring locks basically malfunctioned, releasing in all different directions, causing it to impale, crush, and almost look like ripped tissue. So you could potentially have all of these massive injuries. And then the question ends up being, does it cause you to die from injuries super fast? It just depends on what organs have been hit. The brain was injured, spinal cord severed, if the heart was impaled, those sorts of things. The obvious things. If you lose 40 to 50% of your blood volume in a very short period of time, that's not necessarily sustainable with life. That's hypovolemic shock due to trauma, to where your level 4 on the trauma criteria, and you're basically going to die quickly. You're going to have end organ damage. You're going to have renal failure. You're not going to have enough blood to perfuse your organs, which gives the oxygen to your tissues and to the organs, and they're not going to be able to function. Other situations where we see crush injuries outside of like car accidents would be at like factories, seeing people get crushed by big machines, maybe not paying attention or getting caught, and you can get crush injuries, you can get amputations due to that. But again, usually these are limbs. They're not full body. They're not basically surrounded by something that's going to crush them. Maybe if somebody was wearing like the Iron Man suit, that potentially could malfunction and cause injuries. Oh, I gotta comment on the anatomy. You're seeing all the ribs, you're seeing muscle. It almost looks like there's no skin, or the person's so dehydrated that you're able to see everything through that. Why is this doctor shirtless and almost looks possessed and sick himself? I would never go into a hospital shirtless. Like, come on.
Come on!
Oh! The elevator shaft crushed that thing in the mid-abdomen, kind of lower chest area. What actually happens with that? Rib fractures, obviously, if the area is low enough, so you can snap some ribs, and if the ribs snap, it causes a lot of pain. And unfortunately, when people fracture ribs, there's really not much that we can do at the hospital. They kind of need to heal on their own, unless they're so destroyed. Then there's an evaluation by an orthopedic surgeon. What? Holy cow. Holy cow. Just impaled right through the abdomen, still alive and moving, which is actually more realistic because you're not going to die right away. If it's just punctured through the intestines, it's just going to slowly bleed, especially since you haven't removed the impaled object, and increasing your risk of infection. You could probably be there for at least a couple days. Holy cow. This looks like the old device that they would use in like medieval times, but using almost like a hatchet slash axe onto the anterior chest wall, which again, causing some lacerations, blunt trauma to the chest. You can cause pulmonary contusions or lung bruises. When you have a bruise to your lung, it actually decreases the ability to oxygenate blood flowing through because there's not a normal exchange of gas to the blood. And then obviously you can have a lung collapse and then multiple rib fractures. Whoa! Is that like a pickaxe? Oh! Wow! I didn't see that coming.
I did not see that coming!
Large, long spear, left side of the chest, could hit the heart, could just go straight through the lung. The heart is a central structure. It changes position as we breathe, as our diaphragm is moving up and down. If you're in that moment of an exhale, get that type of piercing wound, then there's a chance that you can potentially hit that left ventricle, which is like where the money is. That's the money shot, basically. What? Come on.
Come on!
This isn't a video game? So you're lacerating your neck all the way across. Please, nobody do this. Carotid arteries and jugular vein are on either side of the neck here, underneath the major muscles. Midline is your trachea and your esophagus. The blood's gonna pool out, not squirt out with every heartbeat. Oh, fall from 1 story up, but it was probably about the height of 10 to 20 feet or so. Unless you land directly on your neck, you're gonna have some blunt trauma, but it shouldn't cause major issues, even though anybody falling from that height, we do treat as major trauma because there is the possibility of a lot of injuries, but immediate death, you unfortunately just have to land in that perfect spot.
Little pig.
Whoa. Versus that kind of fall, which seems a lot higher and probably killed us as a player. What was up with that guy's teeth? He almost looks like a scary clown. These growths on his back, or is it just massive trapezius muscles? The trapezius muscles are those lumps here on the neck where like some of the weightlifters that we see out there just like jacked. Like, where's the neck at? It's because the trapezius muscles are so well developed. Computer. Oh, a syringe. What are they doing there? That needle looked really long. Everybody freaks out with a long needle. But it's actually the wider the diameter, that actually is more scary. It has to do with more discomfort because of the wideness. Sometimes we'll do needle aspirations of like an abscess in a tonsil, and it's easier to use a long spinal needle. That way we're not sticking a huge syringe in somebody's mouth. Same with when we do a lumbar punctures, aka spinal taps. So
I didn't want to have to do this.
So check out that syringe. It's got the thumb holes and finger holes. That is more commonly used at the dental office or oral surgeon's office because of the ability to hold it in one hand. We typically do not use these in the emergency departments. This one you would re-sterilize versus we have all disposable tools in the emergency department. I've used this every now and then. It does make life a lot easier, but you can get done 99% of everything I need to get done in the emergency department with a normal syringe, normal plunger versus one like this.
There is so much yet for you to witness.
Whoa, creeper.
Where'd you get those peoples?
Obviously, if he wants him to witness more, it's probably a sedative of some sort. In the emergency department, we do use sedatives for multiple different reasons. For conscious sedation, aka sedatives, or even anxiolytics, so anti-anxieties, or for people who need to calm down. Versus here, probably using something quite off-label. Fire! Whoa, exploded fire. Fire running past, you gotta be really careful. Sometimes you can cover yourself with a blanket or a fire blanket or something like that, but you're always worried about breathing in the fumes and the flames, so you can burn your own airway. So you have to be really careful. House fires, there's potential for a lot of cyanide due to different plastics that are around, and then obviously any superficial burns to tissue. Oh!
You paying attention?
Wow. I'm assuming he cut off of a finger. Remember, if you lose a digit, grab that thing, wrap it in like a wet gauze, put the wet gauze maybe in a bag with the finger in it with ice, maybe ice water. You don't want it to get freezer burn, but you want to cool it down. You want to stop the bleeding on your own finger, get to the hospital ASAP. And then he smacks him in the face. Actually quite good from a gaming standpoint. He cut his finger off, and we as the gamer got like blurry, lightheaded, had this like weird feeling, which happens. You get lightheaded, you get dizzy, you feel like you're gonna pass out. The medical term for passing out is syncope. This would be described as a near syncopal episode where you're almost about to pass out because you're in so much pain. So that's quite common.
There's a lot for you to absorb.
He's cutting all his fingers off? Oh, he did! Holy cow.
I don't believe that man's ever been to medical school.
So he's missing his index finger on the right and he's missing his ring finger on the left. And actually, it looks like the index finger on the right, you can actually see the bone. So sometimes when you have an amputation, by whatever means, the bone actually is sticking out further than the tissue. How are you gonna close that up, right? So you actually have to use something called a ronger, where you basically are cutting the bone back down, so that way you have tissue to cover over top of that area, especially if you can't reattach it. Oh, almost looks like the humerus. The bone is actually in sharp edges, and that's kind of actually what happens in real life. When the bone fractures, it's not typically a perfect snap. It actually goes in different angles. A lot of times people will have a bone that is displaced, and we have to actually put it back in anatomical alignment. Sometimes we have to be careful not to slice our own fingers. Wow. In through the mouth, right to the front part of the brain. Frontal part of your brain, personality. You typically will see people who get meningiomas or tumors of the brain in the front. Things start to change. They're not showing like outward signs of my arm doesn't work, I'm having weakness or numbness. They're actually having a little bit of personality changes, and that's kind of like one of the early signs. And then late signs are headaches, nausea, vomiting, people passing out. People say, okay, hey, the temple or the side of the head is the softest part. There's no real soft part. You touch your head, it's hard. But could the bone be a little bit thinner in those areas? Yes. So could it have the easier potential for a blade to go through? Yes. But very rarely do we see puncture wounds and injuries going that direction. Most of the time, it's like front and back.
Front and back!
These type of injuries don't come to the emergency department. There's no head, not something I'm going to be dealing with. Then people always ask, oh my gosh, how long does the body live for? You're gonna still have some twitching, some moving, but just for a few seconds. Could there be a little bit longer twitch or a non-specific movement thereafter? Yes, but it's not purposeful. Was that just a saw? We've seen a lot of chainsaw injuries that come to the emergency department. I've seen people getting just a simple laceration to their tissue, maybe hit an artery, maybe hit a vein, close it up, to chopping off fingers, hitting the bone, hitting your own head by accident. I've seen people's hair get caught. In that circumstance, the arm is gone. That is when you would use a tourniquet. Oh my gosh. Tears the person from the clavicle over. The clavicle, most people probably know, it breaks pretty easy. If you fall on your shoulder, it could snap really easy. You can also dislocate it in that area if your scapula has a fracture, your first rib, or your sternum. You have to have a high index of suspicion that there's even something worse going on underneath, because those bones take so much force to actually break. Oh, there it is. You see the vertebral bodies going up, and then again, you're seeing other organs on the inside. Have I ever seen this come into the emergency department? No. Slicing the brain in half and the spine and all that connective tissue. If you get deep enough into the thoracic cavity, you're gonna hit the heart, you're gonna hit the aorta, and you bleed out and die anyway. We see a lot of blunt trauma to the side of the head, and we always worry about the middle meningeal artery. That can cause an epidural hematoma, and you can have a phase basically where you're like, I'm fine, and then you're not fine, and you can herniate. So puncture wound to the eye, you actually see brain matter and maybe skull fragments going flying backwards. It's actually kind of more realistic. If you get so much trauma to your eye, you can't really replace your eye. Hopefully we can soon. Oh, they just love those humerus injuries.
You get people who've got a right funny bone.
Different type of humeral fractures. Proximal, it kind of stinks, but it'll heal pretty well. Mid-shaft we worry about because the nerves and the blood vessels kind of cross underneath in that area. And then distally relating to the elbow and a joint. If the joint is involved, then you have a higher chance for chronic arthritis. Whoa. Eye gouging. I've never seen an injury like that. I've seen people get poked in the eye. I've seen different types of things that cut the eye and traumas, but not somebody else's finger. It's gotta be really painful. And then obviously ripping somebody's skull apart. Not really gonna happen. We have all those like suture lines. You've seen skulls where they have all like the zigzags because our skulls grow as we get bigger and then they stop. And then those suture lines actually fuse together. Whoa! Get out of that situation. Do you bring the legs with you? Yes. Because if it is actually a quite clean injury, there is replantation teams basically where they can actually try to use your tissue to replant the limb back on. I've had traumas where people left it on scene and never brought it. And if you don't have it, you can't reattach it. Okay, so this massive eyeball just being pulled out. What? So our eye has lots of attachment that keep it in. You got 6 muscles, top, bottom, left, right, and then you got some crazy obliques that do this nice movements for us. And then you have the optic nerve with the blood vessels hitting in the back there. Some people have like bulging eyes that are coming forward, and a lot of times we see that in hyperthyroidism. One of the ways we actually test for it is we'll actually look from over somebody's head to see if their eyes are coming further out from the bridge. There's that humerus. Super cool. I actually see the blood in the middle of the bone, so the bone marrow. And there's really cool mesh work of the bone and the structure of the bone where the blood flows through. And I bring this up because we can actually drill a needle. We call them IOs or interosseous, where we can actually put fluids and meds through that. Whoa, okay, so compressive force squishing the neck. We see so many vertebral compression fractures. Now, do we see them like this? No. But we see them when people fall. We see them when people get older and they become more osteoporotic, meaning their bones are a little bit more brittle. Simple things can actually cause their vertebral body to collapse. Oh, whoa, whoa, whoa. Good direct hit to the chest, puncturing the heart, puncturing the lung. If you have a direct blunt trauma to the heart, it's actually still survivable. That's why we do different major invasive emergent procedures at the hospital. A thoracotomy, where we literally crack the chest open, get to the heart itself, and see if there's a hole or a puncture wound that you can actually fix by staples, sutures, anything like that. Just get it to stop. Okay, just massive trauma to the skull, causing the brain to be just destroyed and crushed and brain matter everywhere. So we see people who get skull fractures. You can get a skull fracture from like very minor trauma, but most of the time it has to be a significant amount of force onto like a hard object. When we see people who have intracranial bleeding and subdurals, a lot of times we actually don't see skull fractures. I would say more often than not with head trauma, I see brain bleeding versus a skull fracture when it's that bad. What? So you can see a bunch of intestines on that one. And they're all different like spots instead of just like the classic string of intestines that we see. It was actually just like bundled up in there and then sliced. So they did a good job. Whoa. Wow. Bilateral lower extremity amputation. AKA his legs got chopped off. If I say AKA, to me, that also says above the knee amputation. And then we say BKAs, below the knee amputations. So it's very funny the terms that we actually use in medicine. This was intense. Almost as cool anatomy as like Mortal Kombat does. Oh! Whoa, whoa. Wait a minute, we're doing blunt trauma to the lumbar spine, getting that amount of trauma to your back. My back! People always say, oh, you got your kidneys in the back, like kidney punches. And then obviously you're gonna have destruction of the bones of the lower ribs as well as the spine, breaking off potential of the spinous processes. And then obviously you have the top of your pelvis and you have your iliac crest that can actually fracture from blunt trauma like this. Oh no! Chainsaw injury, it looked like to the right flank. Obviously, I don't see that type of injury specifically, but we do see chainsaw injuries. Typically, it rips, catches, bounces all around. I've seen people who have hit themselves in the head, hit themselves on the arms and on the legs. You'll see basically destruction of the skin all the way down to the muscle tissues. Trying to repair that is actually pretty difficult. Oh! Good defense in the sense of using your hand against the blade. A lot of people would just turn away, but using your hand, obviously it hurts like heck. Our hands are so sensitive. There's so many nerve endings. That's why we can actually like touch and feel things and know what's happening. Okay, we're always vulnerable in the neck because of the jugular vein and the carotid artery. If those are lacerated and you're not able to compress them down, you will lose a significant amount of blood. And if you lose 40 to 50% of your blood volume, roughly 5 to 6 pints of blood, you're gonna die. Oh! That almost looked like a machete.
Machete.
Kind of mid, soft area. Good graphics in the sense that the individual didn't die right away, obviously a couple seconds later. But the spleen is protected underneath the ribs. Mostly where you're gonna get is intestine. The descending colon occurs on outside as well as the sigmoid colon. You could have some small intestines and then your collecting system, meaning your kidney in the back and the ureter coming down. Oh, what is that? When I am at the hospital and I need to get a major central IV line, we're doing major blood infusions, you go to the neck or you actually go to the groin. Even here, your brachial artery is accessible. Typically, we go to the neck. Look at that neck! Because it's a cleaner area. So it does make sense in these games and in the shows that the bad people end up going to the neck. Oh! We actually have in medicine ECT, the type of therapy where you use energy to shock the system, so to speak, and reset the neural pathways. There's not much side effects to it. You can cause some amnesia. Where am I? Typically it returns. You'd use this in people who are bipolar, severely depressed, even schizophrenia. And it's been studied for a very, very long time. And there actually has been good data out there that shows that it has a lot of benefits. Obviously, if you're using too much energy for a too long period of time, then you're gonna fry the brain.
Fries your brain like an egg.
Or cause more long-term damage. Oh! Obviously, it takes a lot of strength to wield a big axe. Then you have a lot of weight behind that blunt object that has a little bit of sharpness to it. So you can cause a lot of damage in the sense of blunt trauma with some lacerations and possible fracturing of bones. If you get hit in the head, you're gonna have the initial trauma injuries to the face, but you could actually get intracranial bleeding, subdural hematomas, epidural hematomas, and subarachnoid bleeding. Freddy Krueger. Look at that glove. Oh! Oh, big knives right through the back into the thorax. Probably pretty rusty. Definitely hitting the heart, lung, aorta. Big major traumas. Obviously, you have to be super strong to be able to do that with just your arm. This injury, I don't see in the emergency department. We'll see sometimes puncture wounds from different types of trauma. Unfortunately, it does happen. People do stab each other. We do full head-to-toe assessment, put tubes in where we need to.
Tubes.
And repair any place that needs to be repaired. What? Come on.
Come on!
Stop clowning around. We definitely see people who lose their digits. Typically, you can't attach these fingers back. Sometimes you can. If you can find the finger, one, stop the bleeding, wrap it up. Don't put directly on ice. Put ice in a bag of water or something like that. Make it like a water bath. Then wrap the finger in, say, a gauze, and then put that in the ice bag. Oh, forearm puncture. Oh, Achilles tendon. Wow. Forearm puncture wound, not too bad. It's going to be mostly soft tissue injury. Down it to the ankle, Achilles tendon ruptures. You won't be able to push off because you basically have just decreased the attachment of your gastrocnemius as well as your soleus and won't be able to run away or walk. And then just destruction to the abdomen. We've actually will do an abdominal exploration surgery where they may need to do from the xiphoid, which is the bottom of the sternum, all the way down to the pubic bone to open somebody up in the case of an emergency. Oh, this is classic for the Scream mask. That's messed up. Getting hit in the back, you always worry about puncturing the lung, puncturing the heart on the posterior aspect. If you puncture the lung, it might collapse. So we actually put a tube on the side called a thoracostomy. If the heart is punctured, it could actually bleed within the mediastinum, which is in your chest cavity here, and cause a compression of the heart itself from all the blood that's leaking out. Oh, nasty. Oh, that's a Stranger Things looking guy.
The Demogorgon.
That's just mayhem and destruction. Surviving somebody who just eats your own head. Not something totally seen in the emergency department, but very cool. I'm a fan of Stranger Things. What? Oh, injection. Cool.
Cool.
One of the weapons is injecting some sort of nasty, maybe infection, parasite, microorganism that's moving fast in the body. In history, for real, people have tried to use different poisons. We see it in the news. Most of the time, there are different types of nerve agents that people are using. Sometimes there's ricin. There's a subspecialty within emergency medicine called toxicology. They study this all the time. Oh, this just creeps me out. That just creeps me out. Not cool.
Not cool.
Fractures of bones. You'd be surprised. There's a lot of blood that actually runs through the marrow. So when somebody fractures a bone, it actually bleeds a lot and swells a lot. It makes it difficult to reset. So if you actually have a bad injury, get to the hospital ASAP so we can actually reset it faster. The more it swells, the harder it is to get back in place. Ooh, Hellraiser. Oh my. Almost look like a modern day Iron Maiden device. Spikes and you're put in it and impales your body. Obviously, all of that is going to cause bleeding. The bigger traumas are going to occur when you actually take them out. I always say don't pull things out when it comes to trauma, injuries, impaled objects. It depends how deep it is, what they've actually injured. If it injures a major blood vessel into an organ, you take that out, it's going to just bleed profusely. Whoa, run away. All I can see is the hands, right? They're in an interesting position, so I'm assuming they're pushing. We actually do a neurologic test where we force somebody's hand like this, and then if they actually have this tick, it's called asteristics. Nice. Pretty smart. But imagine a massive, heavy box falling on you and your body just bends in half like that, so you snap your vertebrae in half. I've actually literally seen people snap their vertebrae, become paralyzed. Typically, they have to do with like falls from really great heights and landing on an uneven surface. Whoa, go, go, go. I've actually seen injuries come to the emergency department from these type of machines, like no joke. What ends up happening is somebody gets caught, maybe a piece of clothing, a piece of equipment, and I've seen people's hands get torn off or fingers ripped off. Oh, no. I've never seen anybody die from this, thank goodness, but you have to be really careful with any heavy machinery. Should they have safety measures on there? Yeah, they probably have them, but stuff potentially could still happen. If you lose an appendage, something gets cut off or amputated off, bring it with you. This circumstance, there's nothing potentially to put back. Obviously, if this happens while you're at a job site, get the patient to safety first. Try to stop the bleeding, either tourniquet or a significant amount of pressure gauze to the area. Get the person to the closest emergency department. Interesting, they have like restricted access. If you guys ever walk around the hospital, you'll see signs everywhere that's like staff only, restricted access. It's actually quite interesting. Like I have a badge at the hospital that it's actually set up to only allow me in certain areas. Oh, whoa, wait, is that a leg going flying? What is that? It looks like directly at the knee. We typically have AKA or a BKA. The knee is made up of your kneecap, proximal part of your tibia, and the distal part of your femur. Wow. Hanging by your wrists in that position can cause significant amount of pain, not only to the wrist, but to the shoulder joints, to the muscles of the chest and the rotator cuff of your shoulder. Oh. We do see this happen in the emergency department occasionally where blood just gets splattered everywhere, or even patients spitting, patients throwing poop, throwing urine, vomiting. There's a lot of different liquids that get thrown around that could end up on walls, the floor, on people. Whoa, we got some new hands. Cool. Say you have a prosthetic and have the ability to change out different types of prosthetics. I know individuals who say are runners, they have like a normal like leg prosthetic and then they have their running one. Well, that's like the blade. I know people have probably seen those. As technology gets better moving forward in the future, there are a lot more options that are coming to fruition. And there could be a point where they have the ability to be controlled by your brain. Oh, we got some electrical energy. Injuries by electricity. Typically, the only time we see electrical type injuries, work sites or somebody's accidentally like hitting an outlet. Most of the time they're low energy and they don't cause significant amount of issues. Just like when the law enforcement uses, say, a taser or those barbs that shoot out and would tase somebody, that is typically within the soft tissue itself, not causing cardiac arrest or any long-term damage, more just causes incapacitation for a very short period of time and discomfort. When they do come to the emergency department, a lot of times those barbs are still stuck, so we have to remove those with force because they'll just come right out, or we have to actually cut them out. If somebody comes into the emergency department with an electrocution type injury, we also want to check to see if there's any breakdown of muscle tissue for rhabdomyolysis, checking out a CPK level. And then obviously we want to check their kidney function as well to make sure it's not getting clogged up due to muscle breakdown. We went from a shock to on fire to being burned. Electrical injuries could cause burns on the inside, but then you do have burn injuries that we do worry about outside of like 1st degree, 2nd degree, 3rd degree, 4th degree burns. You worry about when the burn is that bad that it's engulfing around the individual, that they're breathing in the flames, causing airway disruption, causing melting of the tissue, causing swelling of the tissue, and then taking the oxygen away so you actually can't breathe. Not so much. Whoa! Wow! This one was crazy. What crazy apparatus. It almost looks like Wolverine's claws. Stab right through. Maybe the head is where the motherboard is for these toys and creatures. But again, same thing for humans. But if you stab too low, if you're going through the mouth in a human, you're going more like brainstem and lower part and cerebellum versus like the higher functioning part of your brain, which is higher up in the dome up here. If you have an injury to the brainstem, that's where your autonomic nervous system helps to communicate to everything else, and you might not have function of your ability to breathe or have a heartbeat. We at the hospital do have devices to actually help lift patients, especially if they are a little bit too heavy for an individual lift, because then you don't want to increase the risk of hurting somebody else. If somebody, say, has dead weight, not that they're dead, but they don't have the power to help themselves to lift, that is heavy. Individuals anywhere between 100 to like 500 pounds, yes, you can really hurt yourself because they're also in a bed or in a chair and you're using abnormal mechanics to be able to help them up. So if somebody's trying to lift somebody up from their jaw with their hand in their mouth, would there be any injuries? Maybe some teeth coming out. The jaw would probably stay intact, especially the upper jaw, which is your maxilla, which is attached to your skull. Oh, cool. We got a brain. So they've done a good job. You can actually see the different lobes of the brain. So you have the frontal lobes, you have the temporal lobe, parietal lobe, occipital lobe. That makes up the cerebrum. Underneath, you see something that's a little bit different color. The cerebellum, the balance center of the brain, and then you're seeing the spinal cord come out the bottom. We're seeing a lot of electricity relating to this and energy, trying to maybe activate it, shock it, or harness the energy. In the emergency department, we use energy to restart somebody's heart out of an abnormal rhythm. Oh, they're activated. We would have this happen every now and then. Generators or the backup power in the emergency department, the power might go out or a surge, but there's always backup power at the hospital. You definitely have to keep people on ventilators and have pumps relating to medications that have to stay on for individuals. Oh, what happened to the brain?
Hey, what happened?
It flipped upside down. Now you're seeing the cerebellum.
You and Poppy, it's all your fault! Want to kill you!
Patients that come to the emergency department who are having acute psychosis, they're responding to different types of internal stimuli and they're aggressive. What medications do we give? Do we give them a shot of medications and hold them down to be able to get it in and then have to use restraints and a lot of security? If we can use pills and calmness, that's what we want to do.
Kill everyone who hurts me!
Looks like probably liquid nitrogen, super cold, freezing agent. All I can think about is Terminator 2.
Hasta la vista, baby.
I tried to be better.
Oh, crush injury.
Smart enough.
Crush injuries, they're a real thing. I've seen them many times come into the emergency department, and sometimes we'll have a simple crush injury to the distal end of your finger. People slamming in a door. There's not much to do. We'll put you in a finger splint.
Not good enough. Not.
When it comes to crush injuries, the tissue ends up exploding open. We have to kind of put the meat back together and try to close it up. We'll get x-rays to see what the bones look like. If the bone is fractured with this type of crush injury and it's open, it's called an open fracture, and it increases the risk of infection. So we'll put somebody on antibiotics.
I'm sorry.
I would have to worry about renal failure and rhabdomyolysis and hyperkalemia. What the hell does all that mean? The cells break down, they're destroyed. The potassium is inside of the cell. You get too much potassium into the bloodstream, you start getting into levels where it can cause cardiac arrhythmias. Oh geez, what is that? Yeah, run. Nice, new objective, run. Horror games like this, it really makes me think being in the ER isn't all that different. It's actually why I formulated Chillax by my company Life Happens, an occasional stress support supplement. Check it out at lifehappens.com or on Amazon. The pain of a burn is so bad. 1st degree, 2nd degree, 3rd degree. Don't see 4th degree that often. Even 3rd degree where they say, okay, you burn through all the nerve endings and it doesn't hurt anymore. There's still some surrounding 1st and 2nd degree burn on maybe the edges of those wounds or in different areas. This type of burn, it's engulfing the whole body, which means that all the oxygen is being taken away, as well as the pain will cause you to potentially scream, and you're going to try to breathe, and you're going to inhale the fire, which then increases the likelihood of melting or burning the mucosal membranes. In circumstances where somebody has significant amount of burns, and they're around the head and neck area, and say we see like some soot around the posterior pharynx, or you see a lot of singed hairs around the face, we really think about intubating somebody sooner than later, because what happens is that swelling might kick in when you're not aware. Patient starts feeling discomfort, and by the time you get everybody to get all the equipment to intubate, it might be so swollen that you can't get the tube past all that tissue.